Pancreas is a glandular organ that performs two basic functions. Firstly, it produces and secretes digestive juices via the pancreatic duct into the small intestine, known as the duodenum, exocrine function. And secondly, the pancreas produces and releases insulin directly in bloodstream, playing the crucial role in blood sugar level regulation, its endocrine function. There are a number of benign and malignant pancreatic and also non-pancreatic pathological conditions and diseases that can cause partial or complete obstruction of the pancreatic fluid flow through its main duct. The most common benign conditions causing flow obstruction are bile duct and pancreatic duct stones, while certain malignant conditions can cause extrinsic compression, resulting in pancreatic duct obstruction. Duct obstruction inevitably leads to increased pressure in the upstream duct segment of the pancreas, causing a widening, dilation of the duct, which is easily revealed by most any ultrasound, CT or MRI imaging device. Clinically, duct obstruction results in acute pain and, untreated over time, eventually leads to pancreatitis, acute and chronic. Long-standing pancreatic duct obstruction causes pancreatic tissue atrophy and insulin production impairment. It becomes evident through symptoms associated with progressing diabetes. Medical, surgical, and endoscopic treatment is widely used and accepted. While medical treatments are mainly directed at pain alleviation, both surgery and endoscopy can eliminate the main cause of the problem, high pressure and dilatation of upstream pancreatic duct. Although endoscopy is much less invasive than surgery, it has been historically associated with relatively high failure rates. In addition, in cases where previous gastrointestinal tract surgery has been undertaken, it is often proven impracticable. Our idea, now clinically proven, is very simple and can be described as follows. The basic procedure is an imaging-guided percutaneous drainage of dilated pancreatic duct. It means catheter placement in it, that allows for constant decompression. It is performed without any surgical incision and helps to eliminate or alleviate all previously mentioned problems associated with duct dilatation. Second-line procedures are performed in a few days after drainage. Usually this is pancreatic duct obstruction recanalization. Depending on the cause of the obstruction, it might be stricture dilatation by balloon, stones pushed down into duodenum, or different type stent implantation. Existing drain facilitates the recanalization procedure a lot. However, it's possible to perform both drainage and recanalization simultaneously as a one-step intervention. In case of an inoperable tumor, the recanalization process mentioned above can include technology invented by renowned Dr. Nagi Habib of Imperial College, London. In this procedure, prior to the stent implantation, we perform endoluminal, it means intraductal, ablation by dedicated radiofrequency device. It enables to partially kill the tumor and same time induces anti-tumor activation of immune system. The immediate clinical result is the alleviation and subsequent eradication of pancreatitis. For the patients, pain relief begins immediately, improving over the time. They also no longer require any more dietary restrictions and drugs. In addition, due to the reversal of pancreatic parenchymal atrophy process, diabetic symptoms usually improve and patients need less or in some cases no further medication for sugar level management. To summarize, percutaneous procedures are simple and allow for a more natural healing of the organ those procedures significantly improve upon the patient's post-operative comfort and ensuring quality of life and time. Any patient with pancreatic duct obstruction related problems and pathology. Most frequently, these are chronic pancreatitis patients. Diagnostic and Interventional Radiology Department of new hospitals is the only center in the world with 10 years experience with over 75 procedures of pancreatic duct image-guided percutaneous drainage and post-drainage second-line interventions, which are performed with good clinical results, having practically no complications. The new hospital's Department of Diagnostic and Interventional Radiology is the owner of know-how for pancreatic duct percutaneous interventions technology. Accordingly, we are equipped with some of the best high-end ultrasound, CT, MRI and angiography equipment to provide the highest quality imaging for diagnosis and interventional procedures guidance.